Good evening, everyone, and thank you for joining today's AARP Live Telephone Town Hall. I'm Greg Marshall, and the State Director for AARP Vermont, and today's conversation is with our very own United States Senator Bernie Sanders. We're going to talk about a lot of issues today, local, state, federal issues that all of you are stuff that's on your mind. But most importantly, we're going to take your questions for the Senator live on the air. And you can get yourself into the queue to ask the Senator a question by simply pressing *3 on your telephone keypad. That's *3 on your telephone keypad, and we'll get you in the queue so that you can ask the Senator a question this afternoon. Senator Sanders, I want to thank you so much for joining us today. We know how busy you are, and just would like to open the floor to you right now for some opening remarks. Welcome, Senator.
Greg, thank you very much for inviting me, and let me thank everybody for joining us. And let me begin by mentioning to everyone that our office has some very, very wonderful caseworkers. And what their job is to help any Vermonter who has a problem with Social Security, Medicare, Medicaid, the Veterans Administration, housing, whatever it may be. And you can reach our people at 1-800-339-9834. That's 1-800-339-9834. Please call us if you or anyone you know is having a problem that you think we could address. Greg, let me just start off by saying that, to my mind, we are living in the most dangerous and kind of frightening moment in the modern history of this country. And let me be very frank and tell you what I think, and I think most Vermonters know where I'm coming from. We today have a president who is a pathological liar. It's hard to know when he tells the truth. He is a kleptocrat. Since he has been in office, he and his family have made billions of dollars. He is a narcissist. This guy would like to have half the buildings in America named after him. And he has also pushed some very, very dangerous policies, which I've heard a lot of folks in Vermont and around the country. And I think most significantly, he and his Republican friends pushed forward what they call the Big Beautiful Bill, which to my mind is the most dangerous piece of legislation passed in modern history. And it gave $1 trillion in tax breaks to the top 1%, while throwing some 15 million Americans, including many thousands of Vermonters, off the health care that they have. So throw people off the health care they desperately need in order to give tax breaks to the very wealthiest people. And as everybody knows, when you get out in your car and you're driving around, gas is in Vermont, $4.10 a gallon. Some places in the country higher than that. And that has everything to do with this war that Trump started. And again, let me be very clear. I know not everybody is going to agree with me, but to my mind, this war is unconstitutional. The Constitution is very clear. It is Congress that declares war, not a president. It is in violation of international law. Civilized nations do not simply attack another nation in the middle of the night and kill thousands and thousands of civilians. And the result of where we are right now is many, many men, women, and children in Iran, in Lebanon, in Israel are now dead. And I'm not quite sure what this whole thing, what the reason for this was. We can talk about that later. So that is where I think we're at. I worry also, and I'm working hard on issues dealing with income and wealth inequality. To my mind, there is something very wrong when we have more income and wealth inequality today than we've ever had in the history of the United States. You got the top 1% owning more wealth than the bottom 93%. And if people can believe it, I really would appreciate people taking a deep breath and hearing this. You got one man, Mr. Musk, Elon Musk, the richest guy on earth, now owns more wealth than the bottom 53% of American society. 53% of American households. One guy. And I think that's insane. So you got that reality, and I'm happy to answer questions telling you what we're trying to do with that. to do about that. Another issue, Greg, that I have been focusing on, and I don't know how much people have been thinking about it, and that is the advent and the rapid advance of artificial intelligence and robotics. And we've kind of taken, my office has kind of taken a lead on that issue here. And here is what my fear is. These are technologies that are being pushed by the very wealthiest people in the world. And what very knowledgeable people are saying is that they will likely result in the loss over a period of 10 years of tens of millions of jobs, blue-collar jobs, white-collar jobs. We're already seeing a lot of college kids graduating college unable to get entry-level jobs. Jeff Bezos, one of the wealthiest guys in the world, recently is trying to establish a $100 billion fund to automate factories. And what that means is they're working to make sure that robots replace human beings in warehouses and in factories all over America. But it's only economics. If you talk to teachers today, talk to parents, they're worried about the impact of AI on their kids. You have many children in Vermont and elsewhere who have quote-unquote friends, have an emotional relationship with an AI agent. And the result is these kids are becoming more and more alienated from other human beings and have a harder time to function socially. And I worry about that, and I worry about something else. And we're going to do a national meeting on this. But I talked to some of the leading scientists in the world, people who helped develop AI, been working on AI for decades, including people who have won Nobel Prizes in physics. And what they worry about is that within a few years, AI will become smarter than human beings and might possibly become independent of human control. You know, Greg, we used to see these science fiction movies where the computers rebel against the humans. That's no longer science fiction. That's a real worry that many people have, and the results could be cataclysmic. All right, I've talked too much. I'm sure we have questions and comments out there, but those are some of the issues that I have been working on.
Thanks so much, Senator. Just as a quick point of privilege, I'd like to just say to you that you were the first member of the United States Congress ever to do a telephone town hall with their constituents with AARP, and this is our 25th year doing these calls.
Wow.
And your commitment to older Vermonters is unquestioned, and your commitment to working with us to make sure you talk to our members each year is something that we deeply appreciate. So thank you very much.
Greg, even though I'm 37 years of age, I do think it's important that I communicate with older people. You know how it is. We youngsters.
I do know how it is. Anyway, if you've just joined us with which I know a number of you have, you've joined an AARP live telephone town hall with our very own Senator Bernie Sanders today. And we're going to be talking about a lot of issues that are important to older Vermonters. And there's here to answer some of your live calls. And if you'd like to ask the Senator a question today, all you have to do is hit *3 on your telephone keypad. That's *3 on your telephone keypad, and that will get you in the queue so that we can get you online so that you can ask the Senator a question. We've already got some questions already coming in, Senator. First, we're going to go to Jim in Burlington. Jim, what's your question for the Senator today?
Hi, thanks. This is Jim Barr. I live in Burlington, and I'm an AARP volunteer, Senator Sanders. And my question has to do with transit. In parts of Vermont, if you can't drive, you can't get to a doctor or the grocery store. Vermont currently has a transit funding deficit. So I worry that transit options will only get worse in the years to come. What can be done to support dependable transit and ride options for us older adults?
Well, Jim, you touch on a very important point. Above and beyond the healthcare crisis that we face, it's very hard for many seniors and others to be able to get to a doctor or a hospital when they need to. We are working right now on the Older Americans Act and on other programs which would significantly increase funding for transit. You know, if you live in a city, maybe you can get your go to the doctor, it's walking distance, etc., but not in rural America, not in rural Vermont. So your point is is an important one. We need to fund rural transportation in a way that we haven't in the past.
Thank you, Senator. We're gonna move on now. We're gonna go to Mark in Enosburg Falls. Mark, what's your question for Senator Sanders today?
Yes, my question is concerning health care. As a recent retiree here in the last couple of years, we initially went on to Blue Cross Blue Shield Advantage, which the end of last year was terminated. And along with that was terminated our secondary health care, our vision, our dental that was included in that plan. And we had to take a secondary which is out of our pocket expense of, roughly $155 a month to cover our secondary, which doesn't include vision or dental. We have to pay that out of the pocket now. So
Mark,
I guess my question is about the Blue Cross Blue Shield. Why didn't either the state of Vermont or the federal government do something about them pulling out?
Mark, can I stay on the phone for 1 second? I don't know if you know the answer to this. Can you give me a rough idea how much your family is spending on health care?
Yeah, Senator, we've lost Mark, so he's not going to be able to do that. Sorry.
All right. Well, Mark raises a very important issue, and he's certainly not alone. All over the state, people are struggling with lost benefits. And Mark talks about the loss of dental, hearing, and vision. I don't know if it's going to be tonight or tomorrow, but I will be on the floor of the Senate offering an amendment which would have Medicare include dental, hearing, and vision as part of Medicare. It is pretty crazy to me that those important benefits are not included. I can tell you from experience going around the state and going around the country, you got so many seniors who just simply cannot afford health care. Many of them don't have teeth in their mouth, etc. Not to mention hearing aids and vision care as well. So we are attempting to deal with that. Literally, I will have an amendment tonight, tomorrow. But bottom line here is I think most Vermonters and Americans know the current healthcare system is broken. Its function is not to provide quality care to all, but to make the insurance companies and the drug companies incredibly wealthy, and that's what's happening. And Trump's big, beautiful bill was threw 15 million people off of health care, raised premiums for the ACA, only makes a bad situation worse. So, Mark, I would tell you, if you live up in Enosburg Falls, you are a few miles away from the Canadian border. And in Canada, somehow spending half as much per capita as we spend, they manage to provide health care, pretty comprehensive health care to all of their people as a human right. So that is the direction I think we've got to go.
Thank you, Senator. And again, if you've just joined us, you've joined an AARP Live telephone town hall with Senator Bernie Sanders today. And the Senator is taking your questions. And if you'd like to ask the Senator a question, just hit *3 on your telephone keypad. That's *3 on your telephone keypad, and we'll get you in the queue so that you can ask the Senator a question. We're going to go to Dave in Shelburne. Dave, what's your question for the Senator today?
Yes. Hi, Senator Sanders. Just briefly, healthcare related, my prescription costs keep rising, and I'm wondering what Congress is doing to lower drug prices and make sure the savings are actually reaching the seniors at the pharmacy.
Dave, funny that you mentioned that. I'm laughing here because I spent hours today at 2 hearings with Secretary of Health and Human Services, Robert Kennedy, dealing with just that issue. I will tell you what I am doing. I'm helping to lead the effort to cut prescription drug prices in this country very substantially. As I hope everybody knows, we pay by far the highest prices in the world for prescription drugs, in some cases 5 times more, 10 times more than other countries. And the reason for that is that we are the only major country that does not, across the board, negotiate prices. Now, the good news is that under the Inflation Reduction Act, we passed legislation that insulin prices for people on Medicare will go down to $35 a month. That's a big reduction. So that's something. And next year, importantly for all seniors, and I hope everybody knows this, as a result of that legislation, no senior citizen in America will pay more than $2,000 a year for prescription drugs. So in other words, if you're taking 10 different drugs, you add it all together, you're not going to pay more than $2,000. Is that a step forward? Yeah. Is it enough? No. Bottom line here is what we are trying to do is I've got legislation in, pretty simple legislation, and that is it says take a look at what countries around the world, in Europe, Canada, elsewhere, are paying for a drug, and the United States should not pay any more than the average of what they are paying. If we do that, we lower the cost of prescription drugs by 50%. So this is an issue that is dear to my heart. We're making some progress. We also lowered the price last year of asthma inhalers, which will impact a whole lot of folks. So we're making a little bit of progress, but we've got a long way to go.
Thanks, Senator. Of course, we've got some email questions that have come in, and I want to make sure that I at least get a couple of those in before we go back to the phones. This one comes from Judy in Williston, and here's what she said. As a retired person with Medicare and an established physician or doctor, I strongly believe in the value of preventive care. Yet Medicare no longer covers a true annual physical, only what they call a limited wellness visit with minimal medical value. Just because I'm no longer working doesn't mean early detection matters less. So I want to know whether there are efforts underway to improve the preventive services that Medicare covers.
Well, thank you, Judy, for that question. And she is 100% right, and it's not just what's happening in Medicare. It's happening all over the country. Greg, I can go on about for 28 hours here. We'll stay up all night talking about healthcare. We are spending now over $15,000 for every man, woman, and child on healthcare, combining everything, combining Medicare, Medicaid, the VA, out-of-pocket expenses, what employers pay, et cetera, et cetera. That is an unbelievable amount of money. Unfortunately, most of that money goes to tertiary care. If you get sick and end up in the hospital, you get good care. But unlike many other countries, we are not spending significant amounts of money in disease prevention, keeping people healthy. We do a very poor job on nutrition, for example. So what I am trying to do is put more money into disease prevention so that, among other things, when people become sick, right now in America, there are millions of people. They're sick today. You know what? They can't afford to go to a doctor. They can't afford their prescription drugs. What do you think happens to those people? They get sicker. They end up in the emergency room at great cost to the system. In some cases, they die. Some 60,000 Americans every single year die because they don't get to a doctor when they should. So Judy is quite right. We have got to put a lot more emphasis on keeping people healthy, making sure they get the checkups they need so that problems they have can be detected early. So that not only prevents unnecessary death and pain and suffering, it literally saves the system money.
Excellent. Thank you so much. And again, if you've just joined us, this is an AARP live telephone town hall with our very own Senator Bernie Sanders. If you'd like to ask the Senator a question this afternoon, just hit *3 on your telephone keypad. That's *3 on your telephone keypad, and we'll get you in the queue so that you can ask Senator Sanders a question this afternoon. We're now going to go to Ann in Burlington. Ann, what's your question for Senator Sanders today?
Good afternoon, Senator Sanders, and thank you for taking time to do this call today. We have heard from several people that it can take a long time to reach Social Security by phone or to get claims processed. We know that you're a real advocate for the Social Security system, but what's being done by your colleagues in Washington, D.C. to ensure that Social Security is going to reach people that need it and that benefits will continue?
All right. Ann, you want me to tell you the truth?
Yes.
All right, here's the truth. And again, I know that not everybody on the phone call agrees with me, but this is what I think. You have an administration that actually, and sometimes they admit it, does not believe in Social Security. They don't believe in Medicare. They don't believe in Medicaid. They don't believe in the VA, Veterans Administration. Their goal is to over a long period of time, and when it is politically feasible, to privatize everything. You may recall, and I do because I was there, in Trump's very first State of the Union, he got up there and he said, I don't know if anyone remembers this, so I was there, I remember it well. He says, and you look at Social Security, you got people 200 years old getting their benefits, 150 years old, the whole system is fraudulent. Why did he do that? He went on and on and on. It was all a lie. Actually, within a week, the guy he appointed to be Social Security director came before my committee. I asked him, is any of that stuff true? And in so many words, said, no. We have some fraud, tiny a bit, but 99% of people get benefits paid into it and deserve them. So why did he do that? Why did Elon Musk and these other guys talk about privatizing? They don't believe in it. They see an opportunity for their billionaire friends and their corporate friends to make more and more money. So one of the things you do, if you want to destroy a system, you make it work less and less well. If you had a really efficient system, people say, this is great. Why would anyone want to privatize it? So one of the things that they have done quite intentionally, in my view, is make it harder. They've been closing down Social Security centers around the country where people can no longer walk in the door, including Vermont. And they make it harder. You cut back on your employees. You lay off workers. People make a call. They're on the phone for 2 hours, and they're pretty unhappy about it. So what you ask, what we are doing, we're working really hard to try to make sure that those federal employees that were cut, who were supposed to be doing these jobs, get back to the job and are able to do that. Furthermore, longer term, Republicans, some of these guys, not all, but some of them will say, well, look, Social Security is going bankrupt, in a few years, the safety net is going to be done away with. We're not going to have anything in the trust fund. The answer to that is not complicated. Right now, Greg, as I know, folks in AARP well know, if somebody makes $10 million a year and somebody makes $186,000 a year, they're both paying the same amount of money into the Social Security Trust Fund. That is pretty reactionary, pretty regressive. If you lift that cap and you make sure the people on top start paying their fair share into the system, we can expand benefits, which is what I want to do. Here's an incredible fact, it drives me a little bit nuts. Something like 20% of seniors in America are trying to get by on $15,000 a year, which is, beyond belief. So we want to expand benefits, extend the life of Social Security, and you do that by lifting the cap on taxable incomes.
Thanks, Senator. And just a quick follow-up from me. Have you? I know you've been very engaged in the issue of with the Social Security Administration on wait times. Are you satisfied with any of the progress that's been made, or do you think that there's progress that's been made? And just one more.
They fire people, they rehire some people. We've got a long way to go. I think maybe we're making a little bit of progress on it. But these guys, in my view, their goal is not to be running an efficient system.
Thank you. And again, if you just joined us, which some of you have, this is Greg Marshall from AARP Vermont. You've joined our live telephone town hall with Senator Bernie Sanders this afternoon. And if you'd like to ask Senator Sanders a question, just hit *3 on your telephone keypad. That's *3 on your telephone keypad, and we'll get you into the queue so that you can ask Senator Sanders a question. Let's go to Claudia in Castleton. Claudia, what's your question for Senator Sanders this afternoon?
Thank you very much, and hello, Senator Sanders. This is just a small voice, but I was I'm having a really hard time, as I believe many of other people are, because I've heard them, sat with them, and talked with them in community centers and other places. But my question is, when I found out that ICE was in Burlington, I did not hear much further, either through the news or whatever, as to what was going on in the rest of Vermont. I'd like to know if ICE is still anywhere in Vermont and is active and harassing your people.
Claudia, the best number of weeks ago, Senator Welch and Congresswoman Ballant on the phone, and I met with the governor to talk about these issues. ICE has an office in Williston, and they do what they do. To the best of my knowledge, and I could be wrong on this, ICE is not active in the state of Vermont right now, harassing people. And I will tell you that what took place in South Burlington last month was just an indication of the recklessness and the irresponsibility of ICE. And I think you should know, which is now not a great secret, they didn't even inform local law enforcement, which is, totally absurd. They did not even inform local law enforcement that they were coming in. They overreacted. And you got a high school down the road from where they were. I think it was South Burlington High School. We had Rice in the area as well. Kids were in a lockdown. It was a terrible day. I will just also tell you, as one of those who are trying to lead the effort against the recklessness of ICE, I offered an amendment a while back, which got 49 votes in the Senate, including several Republicans, which would do away with the enormous increase in funding they got in the big, beautiful bill. They got a huge jump in funding, and we try to do away with that. So we are watching what they're doing very closely. I have met with folks from Minnesota and Minneapolis and have applauded how they stood up to ICE. And, I think Trump got rid of his secretary of whatever department it is. So I think they are a little bit less aggressive than they used to be, but they are a danger to what this country stands for.
Thank you, Senator. We're going to now go to Robert in Perkinsville. Robert, what's your question for Senator Sanders today?
My question is about Amendment 28, which I was just notified about, which is the guarantee of Social Security benefits. And I'd like to know why it's not being put through.
Robert, I'm afraid I do not know what do you help me out here? What is Amendment 28 in what bill?
It's a constitutional amendment that's supposed to be going through Congress to guarantee Social Security benefits. In other words, we keep getting all kinds of mail that benefits are going.
And let me ask you, Robert. Can I ask you a question? Did they ask you to send money to help them?
Oh, they all do, and no
Robert,
money goes out.
All right, Robert. There are a lot of, unfortunately, unscrupulous people out there. Oh, Social Security is falling apart tomorrow. Send money immediately. Help us, Bella. And a lot of that is nonsense. I don't know what this Amendment 28 is. So I would take, and I say this to everybody, not just to Robert. You're going to get a lot of stuff on your phones, on your internet, social media that is simply not true. Just scams trying to steal money from folks who often can't afford it.
Yeah, Senator, the point of privilege, I'd like to follow up on that. The Senator Robert's exactly right. The Social Security Administration, if they are going to contact you about anything related to your Social Security account, will do so in certified mail It won't come through Facebook. It won't come through an email. It won't come through a telephone call. So the best thing that you can do is never reply, delete those things, but certainly don't click any links or answer any phone calls, because if the Social Security Administration wants to reach you, you will receive a piece of certified mail, and there will be an actual phone number for you to call. So the senator is absolutely right on this. And Social Security scams, as the senator knows, and probably many of you know, are a very popular scam here in the state of Vermont. If you've just joined us, this is Greg Marshall with AARP Vermont, and we are hosting a live telephone town hall conversation today with Senator Bernie Sanders. If you'd like to ask the senator a question, all you have to do is hit *3 on your telephone keypad. That's *3 on your telephone keypad, and we'll get you into the queue so that you can ask the senator a question. Senator, we did get a Facebook question that came in from Jeannie, I believe, in Irisburg. And I want to make sure we get a chance to share this question with you. It says, addressing significant Vermont poverty issues with our aging population and vast underserved communities. Are there things that you can do to help with rate caps on utility costs? Some states have this, but low-income folks are really feeling it with increased energy costs.
The answer is yes, there is, and I think that's what we should do. Also, we are fighting hard, by the way, to make sure that we maintain LIHEAP. The Trump administration wants to make massive cuts to LIHEAP, which is the low-income.
Please tell everybody what that is. Yep.
That's the Low-Income Heating Assistance Program, which is obviously very relevant to cold weather states like Vermont. A lot of seniors benefit from that, and Trump and his friends would prefer giving tax breaks to billionaires than fund that program. So the answer is yes. We have got to make sure that utility bills are affordable. We've got to protect LIHEAP.
Thank you. Thanks a lot. We're going to go now to Emily in Pulteney. Emily, what's your question for Senator Sanders today?
Are you
Emily,
referring to me?
Yeah,
Are you
go
referring
ahead.
to me? Oh,
Yeah.
I'm in Rutland City.
Oh, okay. I'm sorry,
Rutland.
but go ahead.
No, don't worry about that. Yeah, I'm in Rutland City, and I live in HUD housing, and my question is, how can elderly and disabled tenants in HUD housing continue somehow to have a resident association, which is, they're supposed to be allowed to have that by the property managers? How do we go about continuing to have that when too much high school drama or whatever made the office management decide they just don't want it here, and they dissolved it?
All right, Emily, what I would suggest on that one is give my office a ring. And it's, again, 1-800-339-9834. If you're having a problem with your housing authority, give us a ring and we'll see what we can do about it.
Thank you, Senator. Again, if you just joined us, this is an AARP live telephone town hall with Senator Bernie Sanders this afternoon. And if you'd like to ask the senator a question, all you have to do is hit *3 on your telephone keypad. That's *3 on your telephone keypad, and we'll get you in the queue to ask so that you can ask Senator Sanders a question. We're going to go to Nancy in Worcester for a question. Nancy, what's your question for Senator Sanders this afternoon?
Hi. So initially my question was about so many Vermonters losing their Medicare Advantage plan. I did hear a response to that. So if there's time for a follow-up question, it would be about the lack of providers, because now we not only do we not have good coverage, we hardly have enough providers, and if you need to see a specialist, you're waiting 6 months, and sometimes that's not a very safe and healthy thing to do.
Nancy, you're absolutely right. We're making a tiny bit of progress on that. I'll give you a few examples. It's not only healthcare, it's dental care as well. When we talk about the healthcare crisis, we don't talk about dental care enough, but it is part of the crisis. So I'm happy to say that we have made some progress in developing what I think will be the largest dental clinic in the state of Vermont. My memory is correct, over 40 dental chairs. It's going to be run in conjunction with Detroit Mercy dental school program, and they will be bringing a lot of third and fourth year dental students into Vermont. We hope many of them will stay and help us deal with the dental crisis. What we've also done recently is gotten a bill through an enormous amount of effort working with Republicans on this. It was a bipartisan bill, which increases funding for what we call the National Health Service Corps. And what that does is it says to medical students, if you are prepared to practice in an underserved area, your medical debt will be forgiven. We're also working on other programs to get doctors into rural areas. The Teaching Health Center program is something that we're working on as well. Literally just yesterday, we submitted some grants that came in from the state of Vermont for congressional directed spending, which would increase nursing, increase the number of nurses that we have rather significantly in the state of Vermont. It's not just a doctor issue, it's a nursing issue, it's a dental hygienist issue. So Nancy is absolutely right. In the richest country on earth, spending more on healthcare than anybody else, we have a major shortage, and it is something that we've got to address.
Thanks, Senator. And again, this is an AARP Live Telephone Town Hall with our very own Bernie Sanders. If you'd like to ask the Senator a question, hit *3 on your telephone keypad. That's *3 on your telephone keypad, and we'll get you in the queue to ask a question. We got a few more Facebook questions, frankly, flowing in. I'm going to get one of those in now. Chris has written in and said, I just received a census form which is asking very invasive questions such as citizenship and the last time we have left returned to the country. Do I need to answer these questions, Senator? Seems odd.
Number one, Chris, make sure it is in fact from the United States government and not somebody else, that it's not some kind of scam trying to get information from you. I don't know the answer to that, Chris. I would give my office a ring, 1-800-339-9834.
Thank you. We're going to go to Carolyn in Middlebury. Carolyn, what's your question for Senator Sanders today?
Thank you very much. Thank you, Senator. Is it true that a draft is being instituted in December of this year for military conscription? And if so, is it possible that it can be stopped? I understand this was a provision that made it through the defense spending bill and was signed into law.
No, I don't think that. I think there has been talk. Some talk. Sometimes people just throw out ideas. I think some folks in the Trump administration may be talking about that. But to the very best of my knowledge, no, there has been no legislation passed that would reinstitute the draft, and it's something I would be very strongly opposed to.
Thanks, Senator. We're going to take an email question here. This is from Hoyt. Hoyt did not identify what town he's from, but he says, my kids are out of the house, living and working in other states. I would like to sell my house and downsize and stay in Vermont, but availability of smaller homes in Vermont is very low, and the costs seem prohibitive. Is there anything that can be done by you or folks in Congress about this?
Yeah, there sure is. It's ironically, again, earlier today I met with a half a dozen housing leaders from the state of Vermont, representing various organizations. Hoyt is quite right. There is a major housing crisis in healthcare, and in the state of Vermont, in addition to the healthcare crisis. We simply don't have enough housing. it is astounding. I talk to people who are paying 40 or 50% of their limited incomes for housing. We don't have enough senior housing, and we don't have enough low-income housing. So to answer your question, like, instead of, in my view, giving $1 trillion in tax breaks to the top 1% and cutting back on housing, instead of spending over $1 trillion on the Defense Department, we should be investing very heavily in housing for low-income and working people.
Thank you. And another email question from Sam in Brattleboro, pretty basic. What is going on with the Older Americans Act? That's the question.
What is going on with the Older Americans Act?
Yeah, can you just, I guess he just wants to, what's going on? I guess is the question.
Yeah, we proposed a very significant increase in the Older Americans Act because I think it is an extraordinarily important piece of legislation. It's the legislation that, among other things, provides funds for senior centers to provide congregate meal programs. It is the program that funds Meals on Wheels, and Meals on Wheels in Vermont often has a waiting list, and we proposed a 20% increase in funding for that program. My Republican friends did not agree. Right now, we're trying to reach some kind of agreement, but I hope there is significant increase in funding for something that is very valuable for seniors.
Yeah. And thank you. And just so all the callers on the line today, the many of you out there know what a champion Senator Sanders has been of the OAA, and AARP is a champion of that as well. And we look forward to working closely with the Senator on this. What the OAA provides seniors here in Vermont is incredibly valuable. And thank you, Senator, for your decades, frankly, of leadership on this particular issue. Another Facebook question just popped from Patricia in Bennington. It says, newly retired and collecting Social Security and a pension for over 25 years in public service. I got hit very hard this tax season with the state taxing my pension. Between property tax and this situation, I'm looking to join my family out west or just move to a neighboring state. I love my home in Bennington, and this is a beautiful state, but I am widowed and can no longer make ends meet. Is the state looking at reducing or eliminating this tax that you know of? And I guess, what do you think about these pensions being taxed here at the state level, if you have opinion on that at all?
Well, this is, more of an issue for the governor and the state.
That's right. Agreed. Yep.
But, I want to keep making a point that I hope everybody appreciates. We are living not in a poor country. We're living in the richest country in the history of the world. Senior citizens should be able to spend the remaining years of their life in security and in dignity. They should not have to worry about how they are paying property taxes or, as we've discussed earlier this evening, paying for health care. So, bottom line there is, we need reform of the property tax system. The property tax is, in my view, a regressive tax because it doesn't tax people on their ability to pay. We need major reforms in our tax system so that we end the absurdity of billionaires, in some cases, paying an effective tax rate lower than an average worker. Which takes us, by the way, Greg, to another issue we didn't talk about, and that is the campaign finance situation in America. And, a lot of the questions that come up, and they say, why isn't Congress doing something about health care? Why isn't Congress doing something about housing? Why isn't Congress doing something about property taxes? And a lot of it comes back to a kind of corrupt campaign finance system, which is dominated by people who have a lot of money. And right now we're looking at super PACs as a result of Citizens United. You're a billionaire, you can put hundreds of millions of dollars into a campaign. What do you think these guys want? Do you think they want a fair tax system in which people who have the money stop paying their fair share? That's not what they want. They prefer a regressive tax system in which people like Patricia in Bennington have to pay more than she can afford. So on and on it goes. But to my mind, one of the key political problems that we face is a broken campaign finance system which gives undue power to the wealthy and large corporations who can fund these super PACs.
Thank you, Senator. And again, if you've just joined us late, we're getting toward the end here, but if you've just joined us, this is an AARP Vermont live telephone town hall with our very own Senator Bernie Sanders. If you'd like to ask the Senator a question, please go ahead and hit *3 on your telephone keypad, and we'll do our very best to get you into the queue so that you can ask the Senator a question. Another Facebook question, Senator, that just popped in from Bill in Swanton. What are your thoughts on the potential impact of cuts that Medicaid would have on residents of Vermont, particularly in terms of access to health care services and the overall well-being of more low-income populations?
It is disgusting. It is totally immoral. And I want everybody to know, and if Bill lives in Swanton and literally in walking distance, where, literally walking distance from where Bill is, he's on the Canadian border, somehow or another, not that the Canadian system is perfect, it is not, but somehow or another, they spend half as much per person as we do on health care, and you don't have to take out your wallet when you walk into a Canadian doctor's office or into a hospital. It's publicly funded through a tax system. But they spend half as much per capita. Now, what we should be doing and what I am fighting for, and we're making some progress, it's what the American people want. I'm fighting for what we call Medicare for all, to significantly improve Medicare, do away with the 20% copay, expand Medicare to cover dental, hearing, and vision. And that is the fight we're making. In the Senate, my bill has, I think, 18 co-sponsors. In the House, it's over 100. And that is what the American people want. Now, instead of doing that, what Trump and his friends did is exactly the opposite. Instead of making healthcare universal in America, making sure all of our people have it, they've thrown another 15 million people off of healthcare so their billionaire friends can get a tax break. And because of the cuts they imposed, we're seeing costs for the Affordable Care Act, premiums for the Affordable Care Act, doubling on average, in some cases tripling, even quadrupling. So all of this gets back to, national priorities. Who in their right minds, is there anybody on the phone, and I doubt it, who believes that we should give $1 trillion in tax breaks to the 1%, have a tax system in which billionaires pay an effective tax rate lower than a truck driver, and then, because we don't have enough money, having given them a tax break, we're throwing 15 million people off the health care that they have. Nobody in Vermont, or very few people, think that is vaguely sane. But that's where we are. So to answer Bill's question, it is going to hurt. I've done a lot of work supporting community health centers around the state, and they will tell you that they are very worried. Not only they, other doctors, hospitals are worried about the impact, the negative impact this will have. And by the way, one of my priorities is to make sure that doesn't happen. We're going to make sure, do everything we can to prevent those cuts from being implemented.
Thanks, Senator. Let's go to Kurt. Kurt, what's your question for Senator Sanders this afternoon?
Hi, thank you. Hi, Senator. How you doing?
Good.
I'm from Orwell, and my question is a little bit off the topic of Medicare and all of that, but it's more about politics, and it involves the quote-unquote ballroom project that Trump initiated. To my knowledge, without congressional approval, zoning permits, or any contracting work that needed to be done, anything. So I know that the Supreme Court, not the Supreme Court, but the appellate courts have halted the project. It's being appealed at this point. My question is, once the Democrats take control of the Senate and the House, and ultimately I'm hoping the White House as well, will this project be halted permanently, and Trump and whomever is required to restore the White House back to its original configuration without using taxpayer dollars to do so?
Well, Kurt, thanks for the question. I mean, I don't know what you do when a part of the White House has been destroyed and it's half built. I don't know where you go from there. But this is just another example of a president who could care less about the Constitution or the rule of law. As you indicated, of course, Congress did not give any authority for that. In my view, of course, it is illegal. In the same way that starting a war with Iran is illegal. In the same way that holding back funds for states like Vermont who did not vote for Trump is illegal. These guys happen not to believe in the rule of law. And what they did to the White House, which is, it's the people's White House. It's something that's been around for a very, very long time. If you're going to alter it in a significant way, it should entail a lot of discussion, not someday, one day waking up and find that half of it has been, a significant part of it has been wrecked. So it's just an example of a president, a lawless president, in my view.
Thank you, Senator. Another email question from Scott in St. Johnsbury. This is Senator Sanders. As we know, Vermont is a very rural state with a lot of people suffering from social isolation. What are some of the ways that your team is working to combat loneliness and isolation around the state?
Well, Scott, actually, we are trying to do a lot to address that very issue. For a lot of reasons, economic reasons. We've heard this evening from so many people calling up who are struggling with health care, are struggling with housing, other issues. And on top of all that, I think Trump's recklessness, the war that's taking place now in Iran, the fear of what this guy may do on any given day. I have to tell you, I've been around the state and people say, Bernie, are we going to have elections? Are the elections going to take place in 2026? That is how fearful people are about Trump's attacks on democracy. But to answer Scott's question, I'll tell you what we have very purposely done. I think in the last year, I cannot tell you how many, but we have done a whole lot of events with the entire purpose of bringing people together to break through on isolation. We have in recent months held what we call community dinners. We've done it in Bristol, in Sheldon, in Poultney. During the Christmas season, the holiday season, we held 5 Christmas holidays. So that means food, dinner, people coming together, music. We have a program by which we do foul shooting contests for kids, and we give out free basketballs to kids. And that's a way for kids and people in the community to come together. Kids to maybe get a basketball, do a little bit more exercise, less time on the screen. We have done walks. So we did a walk in Morrisville last year. I cannot believe it, Greg. You know how many people came out to a walk that we did on the Lemoyle rail trail?
You know how many?
600 people came out.
Wow.
Yeah, it's really. We did just 2 weeks ago. I know a woman called up from Castleton. We were at the university there, at the college at Castleton. We did a choir, a high school choir concert for half a dozen schools around the state. So we do dances, literally do dances. We did one in Chester, Vermont. We did one previously that in Colchester. So we are very purposely using, my campaign funds, and this is not Senate money, to try to bring people together to break through the isolation, to develop a sense of community. So that issue is very much on my mind.
Thanks so much. And we have a final Facebook question from Representative Dan Noyes. He said, today, Senator, the Older Vermonters caucus in the State House, we heard directly from directors of adult day programs that allow older Vermonters to stay in their communities and not in nursing homes. He referenced an AARP study that we just released. Unpaid family caregiving now tops $1 trillion a year nationally. And one of the gaps that drives that burden is that Medicare still doesn't cover adult day services. What are your thoughts on that?
I think Dan is exactly right. I mean, on and on it goes. This is a broken healthcare system. So we have a crisis in nursing homes. I'm sorry we didn't get a chance to get into that. I would like to hear from folks about their experience with nursing homes. And people are sometimes driven into nursing homes because they can't get the care that they need in their own homes where they and their family would prefer them to stay. So then what happens? The family member's got to stay home with somebody, can't go to work. That impacts the income of the family. So the choices are not great. But that gets back to another question that somebody raised earlier, and that is a healthcare workforce. We need more nurses. We need more people who help out folks who are disabled or old in their own homes, etc. But Dan is quite right. Medicare should cover that.
Thanks, Senator. And as always with AARP's statewide telephone town hall with Senator Sanders, our hour goes by very quickly. We're sorry we won't get to every single question in the queue, and we'll do our best to answer some of those questions. But Senator, it's really important for us to give you an opportunity to provide a closing statement or a closing message to our members across the state who have listened in today. So go ahead, please.
All right. Well, thanks, Greg. Again, let me thank you and AARP for all that you're doing for our state and nationally. Remind people that if they have issues that you think we can deal with, the toll-free number is 1-800-339-9834. And let me just conclude by saying this. I mean, it's kind of the way I opened. These are tough times. So if people at home are sitting there and they're worried and they're anxious, they're worried about their kids and they're worried about their grandchildren, that is not an unnatural response to the moment that we're in. In Vermont and around this country, about 60% of our people are struggling economically, living paycheck to paycheck. We deal with folks every day having a hard time feeding their families, paying the rent, paying for child care, worried about their retirement. That's a reality. And then on top of that, people very much worry, I think, about what's going on in Washington now. And that we have, in my view, a mentally unbalanced individual, happens to be President of the United States. And people worry what's going to happen tomorrow, what's going to happen the next day. Having said all of that, I do want people to know that we are making progress in turning this around. Good people are being, there's a wonderful young lady was elected to Congress from New Jersey the other day, will be a real strong voice for working people. Trump's poll numbers are just very, very low right now. I think people are catching on to the absurdity of giving tax breaks to the rich and cutting the programs that working people need and going to an unnecessary war. I don't want to get too political here, but I think there's a reasonably good chance that Democrats will regain control over the House, which will mean a significant ability to slow down and put a halt to some of the crazy stuff that Trump is doing. There is a shot that, I'm an independent. I caucus with the Democrats. Democrats may gain control of the Senate. Who knows? If that happens, I'll be chairman of the Health, Education, Labor Committee and be in a position to try to answer and deal with some of the questions that have come up. So I think all over this country we're seeing people want accountability in terms of artificial intelligence or opposition to data centers. It's a moment that we cannot allow ourselves to live in despair or feel helpless. We've got to fight back. This is the greatest country in the history of the world. We cannot allow anybody to move us in a way that we should not be. So I want to thank everybody who's been on the phone this evening, and let's keep going forward together.
Thank you, Senator Sanders, so much. And as always, we appreciate you taking an hour out of, we know, not just a very busy day, but as you've noted, a very busy time. And for all of you AARP members out there who have called in from Swanton to Brattleboro, we thank you for joining us today. Have a safe evening, and we'll talk to you next time. Take care.